So my focus is going to be on my segments today. Two things: necessary purposeful function versus parafunction. Parafunction doesn't become obvious and you wouldn't know what to do about it until you had a real good idea of the necessary and purposeful function and how it works. And if you've got someone in the chair, if you're in the healthcare field, you don't just do stuff. You have a diagnosis, and your diagnosis drives your therapy. The definition of diagnosis is the nature and cause of a disease or injury. It's always twofold. A long time ago, Barry, we'll see tomorrow, is a wizard at identifying the nature of a disease or injury. And in our field, what's the status of the joint? Where's the disc? Is it folded? Is it wiggly? Is it degenerative? That's the nature of this what you're looking at. Then there's the cause. How did it get that way? How did it stay that way? We used to have this really interesting comparison of a guy with a broken leg who comes into the ER with a broken leg. What's the diagnosis? Barry would say, what's the diagnosis? It's a broken leg. That's a diagnosis, I'd say. And they take an x-ray of it and they find the bone marrow's all eaten up, and did they ask how you broke your leg yet? Was it in a car accident, or were you walking downstairs and it snapped in half? Because you've got bone marrow cancer. Is the diagnosis now a broken leg, or is it cancer with the presentation that you've broken your leg? It changes the treatment entirely. So you've got the nature of the disease, this guy's got a broken leg, and the cause, or how it got that way. So when you're making a diagnosis, although you're not identifying normal anatomy or physiology, it's your knowledge of that how it allows you to arrive at your diagnosis, because you don't have this. There's something different about the anatomy that's not normal. There's something about the physiology that might have been going on that makes the patient not normal. There'll be either some abnormal anatomy or there's a pathophysiology. In the joint, we've got abnormal anatomy. Some people have abnormal joint anatomy and they're fine. There's no pathophysiology there to make them symptomatic. Sometimes their joint is perfect, but the patient is miserable. There's a pathophysiology that makes them miserable while the joint's fine, and there's going to be a combination of the two. So you see anatomic deviations, subjective reports. And whatever it is that got it that way, sometimes there can be a trauma, and after a trauma, most people heal. We'll see patients that are telling you about their condition, their headache or whatever, and they say it was from this auto accident in 1983. So, God, you're not better by now? What is it that's keeping you that way? I know how you got that way. How come you're staying that way? So we're going to look at this sort of this cycle of this circle of things. So we'll look at purposeful function in a second, exactly how it works and what you need to do. That you have a necessity for function, and you'll have structures that allow for it. Purposeful function is going to obligate necessary form. There are things that you're going to need to do in mastication, and you will be obligated, you have forms that allow for it. It happens all across nature. If you have the need to capture another animal and hold on to it, you have really long canine teeth. If you have a purpose or a need to chew corn or grass, you have big molars and big masseters. So your purposeful function will obligate the forms that you need to perform that function. Those forms will allow you to do things you don't need to do. You can do weird things with your jaw and with your teeth that there's no purpose, there's no function, I'm going to use the term function as mastication. You can do things with your teeth that they're not meant to do, but you can do them. You'll be doing a purposeless function. The more purposeless function that happens will dictate the altered forms. All of a sudden, now your forms don't look like that they need to. They're an adaptation from your purposeless activity. Sometimes your altered forms will modify what you're trying to do. If you've wiped out your teeth, It makes you chew differently. But you can modify, you can adapt. Nowhere on this screen is anyone complaining yet. There's no signs and symptoms up here. This is just how it works. Once there's signs and symptoms, the practitioner starts to make determinations based on his experience and his education on what he's going to do to treat that patient. Some will say your function is improper, and they'll do a lot of measurements and a lot of recordings, and they'll say, see, your muscles are working improperly during function when you're chewing food. We need to treat your function. They never give any other mind to anything else. Sometimes they look at the altered forms. They say, it's those forms that have caused your signs and symptoms. You see that joint? It's not seated properly. See how that disc is folded over? Do you see how your teeth are wiped out? We have to treat those forms to make your signs and symptoms go away. Or we have to treat the way you function. I'm going to change your teeth so when you chew food, you chew differently. I think it's been over here this whole time. But this is what's easy to see. That's easy to record. So we treat those things and we get success. It's like, perfect. And when you don't get success, at least you got the fee and you move on. You feel bad about it, but you don't talk about it. So I'm going to incorporate now some other parts of our system that is incorporated in everyday necessary function that's always there. We have a real good feeling and understanding for it. We just never talk about it. We're going to talk about the trigeminal nerve a little bit more. Dentistry's daily relationship with the trigeminal nerve is our ability to block its conduction of sensation. We are incredibly good at that. If you want something to be numb from here down, we all know how to do it. If you could just, Dr. Blumenfeld, the neurologist I work with, like anybody else, they want to get into something new to enhance their business. So they want to do Restylane. Restylane is a wrinkle filler. Once you've done Botox for a while and you get good at that, then you go, well, I want to do a little Restylane. Well, it bothers him to do Restylane because you got to feed a needle in this underneath your lip here and then draw it back as you put stuff in there. Gosh, that hurt. They don't know how to handle it. I said, I can make that lip numb like that. That's nothing. Well, how do you make a lip numb? Well, you go like this. You go like this. And he goes, I'm not putting a needle in their mouth. That's sick. I said, yeah, but you'll go put it through their lip and pull it back, and you'll Botox them everywhere. We can get stuff numb. He wants me to get the lip numb so the patient doesn't know what he's doing, so they don't move around. Would you bury a burr into that molar and go into the pulp chamber? No way. So you'll block that. You'll do an anesthetic. You do not want the sensory nucleus having any clue that you're doing something out there. So we block noxious stimulation to the sensory nucleus every day. And it's a thing that a neurologist wishes he could do because their business in the migraine world is trying to figure out how to decrease nociception to the trigeminal sensory nucleus. It's the holy grail. And we do it every day. So when you look at the trigeminal nerve, and you know it's like, when you look at a house wiring diagram, I'm having my house remodeled, I look at it, it's like, oh, it's spaghetti, how do you know? The electrician says nothing. The more you stare at that, the more basic it becomes. But what it really is, this is all sensory input. The sensory nucleus does not assign the same value to all input. And if it did, we would all be driven crazy. It makes a determination on what's important at any given time. If the dentist took a scaler, not even the sharp side of it, and rubbed it across the roof of someone's mouth, what is that for? But take a taco chip and chew on it, that thing is all over the place. Nobody cares. So the sensory nucleus makes a determination, given this situation, on what's important and what you pay attention to. We're going to find out later in migraine, it pays attention to the wrong thing at the wrong time and assigns it more value than it has. And it makes a response that's inappropriate, but it figured it was the right thing to do because it misinterpreted the information to begin with.